think we are live. So welcome everybody. Apologize for that. We had some technical issues, but I'm here with Dr. Hayna Barth, and my name is Jeremy Kossen. I'm a science writer. Dr. Hayna has been a physician that's recommended cannabis for, 15 years?
Yes.
So we're going to talk, this is going to be a series. We just want to open up a dialogue of conversations around women and PTSD. Hayna, maybe you can speak to why you feel it's important to specifically address women and PTSD.
Yeah. Hi. Welcome. So I'm not sure why you're here. Some of you might be here because you have a personal experience with PTSD. You might know somebody. You might have been in an accident. You might have had abuse of many different kinds or neglect when you were a child. Who knows why you're here? But we're all here together, interested in this topic, obviously. And one of the important things that we're going to be looking at is the importance of sleep, how sleep might help you heal, and how cannabis might be useful in that realm. How's that sound?
Sounds good. So maybe speak to what drove your passion around PTSD and how you got interested.
Yes. So I have some PTSD in my own history. Began when I was very young, actually, even through my parents and my history that way. But more particularly over the past few years, in the cannabis realm, women especially, have come to me with their stories. Stories of all kinds of trauma. And in that, I became very, very interested in how to support these women and myself in healing.
And why is sleep, for example, such an important part of recovery?
Yeah. Well, I'm going to actually back up a little bit. I'm going to back up because PTSD is being studied more and more, and the effects on our nervous system and the brain are more and more known. And we have seen through some research that PTSD does alter the brain. Whether you're an infant, whether you're 10 years old, whether you're 40 years old, something happens in the nervous system that is altered so that you have different reactions to things. You have different reactions. You might become hypersensitive, hypervigilant. You might space out. You might not be able to focus. And one thing in particular is that it's very hard for many people to sleep, especially women, when they have PTSD. That's known. So women have come to me asking, how can I sleep better? What can I do? I'm not functioning very well. And that's where cannabis has been useful.
Now, it's important, of course, cannabis is not a cure-all. So I know, a lot of people ask, well, what else can I do to treat the PTSD? And what role does cannabis play in that?
So it's not like treating a sore throat. It's not like treating a headache. Oh, now the headache is here, now it's gone. PTSD is something that we carry with us, that is ongoing, that has many subtleties. It can have subtle symptoms, such as a little bit more anxiety than the person next to you. The door slams, you jump, or you space out more easily and you can't focus. So the treatment will obviously vary enormously according to what the symptoms are and how it presents. If you watch a child who has PTSD, they might not look like they're even present at all. They might look like they're totally spaced out, or they might be very, very angry and attack other children. PTSD manifests in a wide variety of ways. So the treatment isn't one treatment fits all. It's not take this little pill and you'll be fixed. And it's an ongoing process and has to be approached with patience, kindness, compassion, a lot of love for ourselves and for those around us who might be experiencing PTSD.
And have you found that your patients have like a preference for, say, higher CBD strains with lower THC, or pure CBD, or do you get into that?
So those are the specifics, and as I was sharing, it's very individual. What affects me as an older woman is going to be different than a 22-year-old who is functioning in a different way and a different body type. So body types are important. Age is important. And previous experience with cannabis is very important. There's a sensitivity to cannabis that's very different from somebody who has been using it every day for 5 years, another person who has never tried it. So I don't think there's any one answer, Jeremy, that I could share that would be, oh, try this strain. This is a great strain for you. It's something that has to be individualized.
Well, in a lot of the conversations I think I've had with people, it is highly individualized because the physiology is different. Everybody's physiology is unique. I know that Dr. Hart, who I work with and collaborate on the book, in his practice, he recommends that patients have a high CBD strain, a higher THC strain, and more of a one-to-one. Both CBD and THC actually influence PTSD and can actually help, in terms of memory processing, like neutralizing sort of that stimuli that's traumatizing, but also correcting the endocannabinoid deficiency. So it is really individualized. What would you say, is there a good way for people to sort of determine what's going to work best for them?
So, yes, I always recommend to all my patients to start low and go slow. You start with a very low dose and much higher CBD strains with a little THC added over time. You want to see how it affects your body. I'm a very petite person. What's going to affect me is going to be different than might affect Jeremy, who's a man, a little more muscular. So since we don't know what the effect is going to be, we want to start slowly. We don't want to re-traumatize ourselves. We want to be kind. There's no rush. PTSD is not something that's going to be cured overnight. So you want to take your time. You want to have patience. You want to have presence, pay attention. How is this affecting me? Keeping a journal is wonderful. Keep a journal of the strain that you start with. This percent CBD, add a little THC, slowly increase over time and see what happens. We don't know. We want to be open to the effects. And it's also important to have people to talk with, to confer with, possibly a therapist, a doctor, to document what's going on.
Yeah, and you mentioned in terms of the keeping a journal, how important that is. From both, and do you have a recommended protocol, like, sort of like 3 times a day to kind of checking in, or once a day, or, documenting what strain you took, how it made you feel?
Yes.
What's sort of the... Great.
So the first thing I say to people is, don't start in the morning on a day when you have a big, important conference to go to, and a lot of people around, and you're going to be overly anxious just because of that. I say take a time when you're quiet, you're at home. Get out your journal, put on some music, and try a little bit of high CBD. See what happens. Wait a few hours. Wait till the next day. There's no rush. Keep a journal, write down the strain, where you got it, how much you took, and keep that journal as you're adding different things, but start slowly. There's no rush. If you start with a tincture, because as you know, or may not know, there's many ways to use cannabis. There's tinctures, there's vaporizing, there's edibles, there's smoking it, there's capsules. There's so many possibilities that you want to start slowly with one and see how it affects you.
And how do the different intake methods influence sort of the symptom management?
So smoking it is immediate. I don't necessarily recommend that as a starting as a way to start. I would say something you might want to start with are tinctures, because you can measure them out. In a little tincture bottle, it'll say 4-to-1 CBD to THC. It might say 8-to-1 or 1-to-1. So you can tell, you take 2 drops and see what happens. This morning, I was talking with somebody at my clinic who said, well, you recommended the tinctures, but they taste so bad. So I said, great, there's so many other options out there. Yes, that tastes bad, so you stopped using it. So try something different. Try a gel. Try 1 hit of a vaporizer. There's no magic way to use cannabis.
Well, sometimes, I mean, there are so many different options. How do you keep yourself from getting overwhelmed by, sort of paralysis by over-analysis of all these different
Yes,
things?
that's a good question. So I would start with a tincture, like I do with many of my patients. And vaporizing for many people, if they want a more immediate effect, as long as you keep a journal and stay conscious of the way you're using it. It doesn't necessarily matter how you start, as long as you start low and pay attention to the effects in your body.
And maybe you touched on it a little bit, but more on why sleep is so vital in terms of just recovery in general, and why it's important to be able to manage that aspect.
Okay, great. So the nervous system, your body, it needs sleep. It needs sleep to heal. It needs food. It needs air. It needs a certain amount of the basics in order for us to survive at all. And with PTSD, a lot of people have difficulty. A lot of people have difficulty falling asleep, staying asleep. Often there's waking up too early. And sleep in and of itself is healing. To be able to fully relax the body is so important. The nervous system is able to heal, your metabolism changes. So using a little bit of cannabis at night when you're wanting to go to sleep can be very healing for the nervous system itself.
And what about like mindfulness exercises and yoga and things like that, non-sort of pharmacological or drug interventions?
So yeah, those are wonderful. They're all something that is going to be individualized. It's not like all people, all ages, all women should do hatha yoga, for example. No, that's not true. The most important thing is paying attention to your own system to see what is working. Oh, I tried this meditation at night, and there's so many apps nowadays. There's apps on your phone, there are apps, you can go to your computer, you can go to a course, and then you keep track. Oh yeah, this was helpful. Oh, I slept better. I slept 20 minutes more than I usually do. I slept an hour more than I usually do. No, this was a little bit too energizing. It didn't help. Yoga in the morning might be better. Yoga in the evening might be better. There's no one answer.
And what about, there's a lot of people, they've tried, they've been maybe prescribed Seroquel, maybe SSRIs, different things. Now they're trying cannabis, and they're still finding frustration because it's not working. How would you advise that?
So, if you are on medication, you don't want to abruptly stop it. That's not a good idea. And if you are in therapy or seeing a psychiatrist, and you want to work with that person if the medications are not working. The interesting thing about PTSD is that it can manifest in so many different ways. It can manifest as anxiety, it can manifest as depression, it can manifest as bipolar. and it can be misdiagnosed. That's one of the difficult things, is that a lot of women with PTSD have been misdiagnosed with all these other conditions. ADD. ADD could be a reaction to the PTSD itself, a kind of way of not being able to be still. And then they're prescribed medication for that. It comes down to having somebody that you can trust. And trust, of course, is very difficult for somebody who has PTSD. And learning to trust yourself. That's why keeping a journal can be really helpful. Learning to trust yourself and keep track of what's going on in your own system.
Now, there's a question about, Deborah has about alcohol affects recovery. Maybe speak to how, one, I guess, how alcohol could negatively impact recovery, but also why cannabis potentially works for so many people.
So I think you, Jeremy, know a lot more about this than I do, relating to the endocannabinoid system. So maybe you could just say a couple of words about that.
Absolutely. So people that have, anyone that has PTSD, what they found is that there's an endocannabinoid deficiency almost universally. So people with PTSD have on average 50% less anandamide, and anandamide is the mimetic, is the twin of THC. So clearly, if you've got lower anandamide levels, that's going to adversely impact you. So there's the cannabis helps compensate that deficiency, but also in terms of just how we process memories. Cannabis is very helpful in terms of neutralizing those adverse memories. So that's kind of the basics on how the science works. Alcohol is definitely not the best thing to do, because it's very it disrupts your sleep. It disrupts it can be numbing. I've had patients say, cannabis makes me sort of think about the issues, but in a less sort of reactive way, whereas alcohol just makes me forget, numb it, and it just creates a cycle that's even worse.
Yeah, that's a good way to look at it. The truth is that healing PTSD, dealing with PTSD, is an ongoing, long-term process. It's not something that you can do in a week with a few hits of cannabis or a few pills or a few anything. It's something that takes a lot of patience and love and compassion, because PTSD arrives because there's been trauma, and trauma isn't very trauma disrupts your nervous system, so we have to approach it gently, carefully, with a lot of generosity and compassion and spaciousness. And meditation can be very, very useful. In fact, there's a book I wrote, helped to write, about meditation and cannabis.
What's the name of that book? Is that marijuana mindfulness or something?
Yes, mindfulness and marijuana.
Got it.
So that can be useful, to be more mindful, to be more present, to be more awake to our own process.
Now, where do you mentioned that you have worked with a lot of patients who didn't necessarily even know that they had PTSD, but they're diagnosed,
yes.
misdiagnosed.
So women come to me with just one symptom, for example, anxiety or depression. And just by talking and being open to their experience, I am able to point them a little bit in the direction that PTSD might be the root cause of this. I'm going to ask you. So these questions here, Jeremy, are these questions that
we've been addressing them.
Okay, are these questions that are coming in currently at the moment?
Yes.
Oh, great. So I can't be reading the questions
Right.
while I'm talking.
I've been
While
trying
I'm
to work
talking
them
to
in.
you. Yeah, thank you for doing that.
So Deborah, I'm going to follow up with you afterwards because I can put you in. I can email you some more specific resources and stuff like that that you can take a look at.
And we would welcome you to email us a lot more questions. I'm more than happy to answer what I can in some emails or in future dialogues. We're going to have these dialogues. They're going to be ongoing. And we'll be a little more prepared with our technical issues, the technology, so we don't make you wait.
Well, thank you so much, everyone. And we will we'll send a follow-up email with the video and also some free resources. Looks like somebody else has hopped on now and has a question that we could try to answer. Kate, or is that just to say hi? I think she's just saying hi. So
Hi. Okay. Welcome to all of you, and I wish you all the best in your healing, because it's a very difficult thing to live with PTSD, but it can be healed. We know that. And you can sleep better, you can eat better, you can have less anxiety, you can have less depression. It's definitely possible. I've seen it over and over and over in my practice, and I want you to walk away and go away with this, with the possibility that you can heal, no matter your age, no matter your experience. It's something that I've seen a lot.
well, thank you so much. Thank you, everybody.
Thank you.